Prenatal Perinatal Network. And I want to welcome you to the open house that Buffalo Prenatal Perinatal Network is hosting this morning, both virtual, and we have some individuals in the room here with us at the offices. And I would like to welcome our funders, community partners, and elected officials. As a board of Buffalo Prenatal, we are 26 members. We represent a diverse group: healthcare, health insurers, colleges, informational technology, faith-based groups and organizations, not-for-profits, and we also have a Buffalo Prenatal Perinatal mom who is also on the board. So it's a pleasure to be here today, and look forward to having a very nice presentation here and get to know one another and what Buffalo Prenatal is up to these days. Luann?
Okay, good morning. I'm Luann Brown, the CEO at Buffalo Prenatal Perinatal Network. So I'm going to do a couple things. For those of you who are not familiar with our organization, many of you are, but it's always good to have a little history. So we have been here since 1987. Actually, our organization was initiated by Governor Mario Cuomo, so that's how old we are. And he was concerned about the high rates of infant mortality and low birth weight infants. So he made 16 networks. I think we're down to 14 now at that point, and we're one of those networks. So our prime focus is reduction of low birth weight infants and infant mortality, but we obviously focus on other health issues. And we have 3 programs, which you're going to hear from either the program manager. We have one of our program participants that's here that's going to talk a little bit. But our 3 programs are we have a Healthy Families New York program, which is part of Healthy Families USA. And that is a home-based program that focuses on parenting, child development, prevention of child abuse and neglect, and also helping the moms work with self-sufficiency, whether that means going back to work and going back to school. And Anne-Marie Correa, who's the manager of that program, is going to talk a little bit about that. We also have a community health worker program, which is kind of our boots on the ground staff that works with women from 14 to 40. They are really working with those women that are most impacted by economic, educational barriers. And I'm going to talk a little bit about that program. And then our newest program is our Fatherhood program. And you're going to see a video about the Fatherhood program, and Antoine Johnson is here to speak a little bit about that. So we focus mainly on the east and west side of Buffalo, and primarily on African-American Hispanic women, because they have the worst outcomes as far as infant mortality. The Healthy Families program does go a little further out, which Anne-Marie will touch on, but they do go out into South Buffalo, Cheektowaga, Lackawanna, a little bit of Hamburg, and a little bit of Tonawanda. Besides our programs, so our programs are all free, they're all voluntary, and there are 2 women's programs are in client homes. That's what's unique about us. So we have community health workers and we have family support specialists. So our work is done in the home, which is a very different experience than when you're talking on the phone to somebody. I mean, you're actually in their environment, you're seeing the barriers they have. We have support groups that we run here as well. You know, pre-COVID, we shifted to some virtual, but we run breastfeeding support groups in both our programs. We have a scrapbooking group that Healthy Families runs. It's kind of a nice stress reducer for our moms. And we also run an empowerment group, which is facilitated by the Horizon Behavioral Health, Mental Health Counselor for our moms experiencing postpartum depression. Many of you know that 30% of women have some type of depression after they have a baby. So it's a huge issue, and we really felt like we needed to address it. So that's a little bit about what we do. I'm going to talk about COVID a little. I know everyone's sick of it, but in last March, when all the shutdowns went down, you know, we immediately pivoted. The staff actually worked remotely for 3 months. So they were doing, since we're a home-based service, we had to shift to phones and FaceTime and dropping things off on people's porches. We ended up setting up a pantry here. Our clients either couldn't get to a pantry or were nervous about going into the public area. So we actually set a pantry up here with basic foodstuffs and, baby diapers and wipes. We had some wonderful volunteers that helped deliver besides the staff. And then we actually partnered with the Queen City Bike Couriers, and they were wonderful. They volunteered and they delivered food for us. I mean, like 40 pounds of food on their bikes. So it was really good. The staff came back into the office in June on a kind of a round robin schedule. And then July, they were all back in the office, not without a little trepidation, I will tell you. Obviously, a lot of concern. We made the environment as safe as we could for them, but there was a lot of angst like every other workplace, but they really stepped up. In August, we started doing home visits again because in a lot of cases, our clients, we are the only support they have. They're estranged from their family. They don't have family here for whatever reason. So we continued home visits. We stopped in November when the COVID spike happened, and then we restarted in March. So we've been kind of going forward. Since then, we've started to do some of our groups back, which I know our clients have appreciated. Healthy Families has done some outside events at the zoo, at Explore and More, and the clients love that. So, we're kind of getting along, trying to ensure that we're educating our clients about the vaccine and the importance of it and the safety of it with pregnancy and breastfeeding, because that's one of the myths that's out there. We also are educating our own staff and, trying to bring in experts to talk to them about the vaccine. So I think we're in a better place than we were a couple months ago. Still some angst, obviously, with the Delta variant. People are nervous, but we're trying to provide a safe place for both our staff and our clients. Our exciting news after COVID is our new logo, which I think Denise is going to put up here. So those of you who've known Buffalo Prenatal for a long time, this image here of the three women, which I'm going to explain it because some people have different impressions of what this is. So we care for women who are not pregnant, or are parenting. So that's the transition of the women. We felt it was important with the fatherhood piece that we had the dad in the picture because he's an important part. That's what we started the program. Dads are just as important. Sometimes they're kind of forgotten. So this is our new logo, which we're very excited about. The Martin Group actually developed this for us. So I just wanted to point that out. So you'll see that on all our materials now. As far as future plans for Buffalo Prenatal, I think that, we're 95% grant funded, which is a blessing and a curse sometimes. If you lose a grant, and we experienced this last year, Healthy Families and the Community Health Worker Program both took a 20% cut because of the New York State budget and the COVID and the federal budgets. So we unfortunately had to lay people off last year. We laid 7 people off in September through some generous funding. And I'm going to mention the Blue Fund. I'm going to mention the Oshai Foundation. I'm going to mention the Key Bank. I'm going to mention the Western New York COVID, who really stepped up and helped us. We were able to bring a couple staff back in January, and then actually everything was restored. So we were able to bring people back in March. But that was an additional burden. People had to pick up more clients. We had to kind of triage our clients and see who really needed the help. So it's taught us all a valuable lesson. I mean, the management team really stepped up, the staff stepped up, but you can't rely on grants forever. So we are really trying to set a course that we are able to contract our services. I think there are insurance companies. I think there are hospitals that should probably pay for our services because of our outcomes. The quality metrics that they look at, we excel in. Our immunization rates for our kids, our postpartum visits, our initiation into prenatal care, our smoking cessation. We're like 90% and above for all those rates. Those are all things, and eventually it saves money. And probably the biggest one is that we reduce low birth weight infants. Every time we get a mom to full term, that's one less baby in the intensive care nursery. So it's a savings not only for this community, but everyone. So for those of you listening, that's our next goal. I think we have to have a diverse path, that we can have some unrestricted funding. I need to bring my staff up to livable wages. Luckily, our funders are hearing that a little bit more. And have actually kind of instructed us with our new RFPs to make sure that we are bringing people up to livable wages. A lot of my staff are single moms, so they really rely on, and I don't want to lose people because they really love their jobs. So that's the future plans. And I think the last plug I'm going to do is the meat raffle, which is our second year we're doing a virtual meat raffle. For those of you from not Western New York, this is like a Western New York phenomenon, but we're doing it again. It's November 16th. It's easier to some extent for people because you can watch from home. It's over in an hour. And then we do the pickups on the 20th.
That's Saturday.
Yeah, so we'll be doing pickups of the meat on the 20th. So if you're not doing anything on the 16th, or if you are, just buy a ticket and you can win some, I don't know, pizza logs or.
And we're gonna have turkeys too.
And we're gonna have turkeys in light of the time we're doing them.
Right.
So.
Pizza logs are very popular for some reason.
Yes, they are. All right, I think that's all I have.
Why don't we
So I'm gonna,
introduce-
so we have a special guest.
Introduce everyone. We
Yes.
can do introductions. So.
All right, so we want everyone to go
can
around.
Introduce themselves here, and then I'll do the Zoom.
Okay, so I'm gonna have everyone go around and just the people that are in the room here, so just so people know who are in the room here. So
You can talk a little loud, so it'll
Yeah.
hopefully resonate for the Zoom folks, and I'll repeat.
So Anne-Marie, why don't you start?
Good morning, I'm Anne-Marie Correa, and I'm the program manager for the Healthy Families program here.
Nora?
Hi, I'm Nora O'Brien Surik. I'm the president of the Health Foundation for Western and Central New York. Thank you.
Hi, I'm Tiana Brown. I'm one of the 3 health worker volunteers.
I'm Jessica Paulson from Senator Tim Kennedy's office.
I'm Logan Marquardt. I'm from Councilmember Farrelletto's office.
Melissa Lang from Assemblyman Bill Conrad's office.
Bill Conrad, Assemblyman. Antoine Johnson, Program Manager for the Buffalo Fatherhood Initiative.
And I'm Denise Herky-Jarash. I work for Buffalo Prenatal, working in the development office. And I want to recognize a couple of our board members. You met Mary, who spoke at the beginning. Brooke Smith is on the Zoom. She is chair of our sustainability committee. Whitney Mendel is on. She is the chair of our program committee. And Dr. Dion is on. She's new to the board. She works with the dental students and has been fantastic at getting a lot of dental students to volunteer with us, especially this summer. So that's been an extra great thing. Also online, we have Mike Ball and Don Ingalls, and if I mispronounce your names, my apologies, from Highmark Blue Cross Blue Shield of Western New York, and representing the Blue Fund. We have Courtney, where is it? It's like I flipped so quick. Let's see, we have, all right, I think what was confusing me, oh yes. So we have Courtney Ball, excuse me, from Senator Gilbrandt's office. We have, yeah, why is this jumping on me? Sorry. All right, not gonna rely on the mouse. Krista, also from Highmark Blue Cross Blue Shield. Valerie from Niagara District Council Member David Rivera's office. Gabby Harrington from Senator Ryan's office. Mr. Griffiths, he is a graduate student at UB, and he is our fellow for the year, and he's joined our board, and he's going to be learning about board of directors and helping us in that capacity. Miss Davis, I don't want to mispronounce your name, from Majority Leader Crystal Stokes' office, and Stephanie White from Ellicott District Councilmember Darius Pridgeon's office. So I believe I captured everyone that is on Zoom. We have 17 on Zoom. Thank you for being here, both on Zoom and in person. And I will now pass it back over to you.
Okay, and I'm gonna pass it over to Nora O'Brien Surik. You can come right up here, Nora, sit next to me. This is like Kelly and Ryan. Okay, you can sit here.
Hello.
Hi, how are you?
I'm great. How are you?
Good. So do you want, do you want to
I-
talk a little bit? And
I
I've got some things I
do.
can add.
Okay, that's great. Thank
Yeah.
you. So I wrote down some notes that I wanted to make sure I remembered to say the really good things about Buffalo Prenatal Perinatal Network. So first of all, I'm the president of the Health Foundation for Western and Central New York. And our vision is a racial and socioeconomic equity that are prioritized so that all people can reach their full potential and achieve equitable health outcomes. So we've been here in the community for 20 years next year. We focus on children, the most vulnerable populations, children, young children who are impacted by poverty, older adults in their later years vulnerable with their health conditions. And we also provide supportive services for organizations that we partner with in the community called our Building Health Capacity. So that we can make sure that the nonprofits that we work with, our grantees, are successful and sustainable. So we are so pleased to be partnering with the Buffalo Prenatal Perinatal Network.
Just say BPPN, it's easier.
BPPN, yeah, because the Health Foundation, the foundation always needs partners in the community. We can't do anything. We are mandated to give our money away. We are a health conversion foundation, so we focus on health outcomes, but we need wonderful partners in the community to help us achieve our mission and help them achieve their mission. So it's really a win-win. It's a great partnership, and this is such a wonderful partnership. And I'd like to tell you a couple of examples of why that is. So BPPN provides critical services, very important in the community. And so we wanted to make sure that, of course, sustainable, successful. And so actually they participated in 2017 in our Get Set program, which is selecting organizations to come together to learn how to be sustainable and successful, things like board development, fundraising, marketing. And so while you were at Get Set, you developed your value proposition, which is so important in order to communicate what it is that you do effectively in the community so that you can attract other sponsors and funders.
Right.
So important. So we're really so pleased that you participated in that. In 2018, we also provided supportive funds for the Responsible Fatherhood Initiative Nurturing Fathers program, and Antoine is the magnificent leader of that. So thank you for all you are, Antoine, all you do. You are a remarkable advocate and a great voice in the community for fathers. And because of your work, I'm assuming that's why there's a father figure now in the new logo. So congratulations on that. So the Nurturing Fathers program, for those of you who might know, is an evidence-based program for that builds better relationship skills with fathers to reduce arguments, to reduce the negative language in the home, to reduce the interpersonal violence. So in essence, it helps reduce what children are exposed to in negative behaviors and to have better modeling with their fathers. It lowers the violence and the conflicts that kids are exposed to. And the parents learn better self-control and better interpersonal skills. So it's really a great program, and we're so pleased that you're participating in that. When fathers are involved, we know that there are better health outcomes actually for children. So it's 43% more likely for kids to achieve better grades in school. 33% of kids that have fathers are participating with them are less likely to have to repeat a grade in the school. The kids have higher levels of social ability, confidence, and self-control. And with the fathers more involved with their children's life, the kids have better social, emotional, behavioral, and academic outcomes. So it really is a great program. The other program that you participated in, I know Antoine, I think that's where I first met you, is the Story Growing, participating in that. Now the Story Growing is an initiative that the Health Foundation partners with the OSHI Foundation to bring organizations together to learn about telling their story, which is so important to communicate what you do. So obviously that helps with marketing, with raising public awareness, and also in your fundraising campaign. So that's actually where I first met Antoine and really learned much more about the BPPN. Also in 2020, the Health Foundation started the co-creating well-being learning community, right? Now this is, it's a trauma-informed practice and it's focused on reducing ACEs, adverse childhood experiences. So again, it's continuing to work with the fathers and in understanding the developmental milestones that children go through and to be aware of when there's any delay in that. This also helps engage with kids in fun, interactive, positive ways with the fathers, to support fathers to engage in important information about their kids' development and how to best support them in their life. So really pleased, I met Anne-Marie on the way up here, who is the person who's participating in that. This is actually, it's a 10 session. Oh no, this is the training, the call to action, which I'll get to in a minute.
Yeah.
The call to action, that's what you're participating in. This, as you can see, there's a lot of initiatives that we partner in. So, so I'm have my cheat sheet here to keep them all.
Me too, I do too.
Yeah, so the call to action. Let me jump into that because this is a new program that is helping. It's a train the trainer program to help organizations understand more about health illiteracy and to bring increased health literacy in the community. So Anne-Marie is actually participating in this. She's being trained on, and we'll bring that training forward to the organization and out into the community. So it's a professional health literacy to train in health competencies and also in the universal precaution strategies in health. We know that in many communities, there's a distrust of the health community, the medical community, and probably for good reason, but we're really trying to turn that around. And as you can see, it's so important with COVID that people have better understanding of what COVID is. And, you know, there's still a lot of communication and confusion about, can I get COVID if I'm pregnant or breastfeeding? So I'm so glad that you're training on that. I should send my daughter-in-law to you. She's due in November and she won't get her vaccine. And I've tried everything. So
I'll take a shot at her.
Thank you, Luann. So anyway, so this, the call to action literacy training program, it helps build trust in the medical community. It addresses the lack of communication and the misinformation and misunderstanding. So as I said, Anne-Marie is leading that, but I'm also really pleased to say that Anne-Marie is one of our new fellows. So the Health Foundation supports the Health Fellows Leadership Program. And this is where we actually, we identify people who are already leaders in the community, but we bring them together with the other leaders to train, to help learn to collaborate in the community. We know that nothing can be done unless you collaborate with everybody, right? It's foundation partnerships, it's government partnerships, it's other foundation partnerships. Hello, Michael Ball. And so we know that collaboration is essential. So I'm so pleased that Anne-Marie is now our new fellow, and that cohort 10 is going to start. It was supposed to have started this fall, but because of COVID, we're delaying it now until the spring. So those are all of the programs that I know that we are partnering with. We are so proud to be partnering because we need you, and just really want to give accolades to Luann Brown for her vision, your tenacity, your determination, and your just wonderful partnership and what you do in the community. So thank you. Thanks for inviting me to be part of this.
Thank you. And I just wanted to mention, you hit all my things, Nora. I can't believe it. The only one you missed is you actually also funded not just programs, but you actually, the Health Foundation also funded CO monitors for us, CO2 monitors that we use for our smoking cessation program. That's one of our programs where we actually, you know, luckily, although we did see a spike during COVID, I will tell you, we did, you know, we had a lot of women that were not smoking and all of a sudden it spiked, which we kind of understand, but we actually measure them with the CO2 monitor. We incent them, like every time they go so many months, we give them diapers. So you guys also funded that, but I just want to mention the Get Set program, which is like when I first came in, a lot of work, but a wonderful, wonderful program. And we had some great organizational development people that worked with us. We did a lot between our employee engagement and our value proposition, our capacity plan. So it was a great program. I'm thrilled Anne-Marie is doing the health literacy and the fellow. I did the fellowship program when I was at Children's, and it's a great program. So You are a great partner, so we're so happy you're here.
I am so pleased to be here, and I wanted to be here in person. I got stuck looking for parking. Finally found 8 quarters.
That's the problem. Yeah, I know.
So thank you, and okay, congratulations.
Thank you. All right. All right. So I'm going to talk a little bit about our community health worker program. We have our big 5-year RFP coming up. So my manager is kind of knee deep in that. So she wasn't able to be here. But so our community health worker program, I mentioned, cares for women between 14 and 40. You do not have to be pregnant to be in this program. You can be not pregnant, you can be pregnant, you can be postpartum, you can be in between deliveries. I call them the boots on the ground staff just because they're looking for people who are not connected to the system. So pre-COVID, they had started a very creative way to engage clients. It was street outreach, which was kind of new, even in all the Mitch programs when I talked to my peers. So they actually go into, East and West Side, they're knocking on doors, handing out cards, and they get like 70% of their referrals from those. They may not call right away, but they may call the next day. So that program, the first thing they do is they make sure they have a health provider and health insurance. And then they're working on all the social determinants of health. So that's housing, that's food, that's baby basics, that's clothing. So it's a pretty intensive case management program. It's not unusual that they would spend 6 to 10 visits with a mom or woman. And again, I think the difference with our programs, as I mentioned, is that we're in the homes. Healthy Families is in the homes, community health workers in the homes. People can tell you whatever they want on the phone, but when you walk in their homes and you see them sleeping on the floor, or you open the refrigerator and they have no food in their refrigerator, it's a very different experience, and it's a privilege for us to be able to do that, for them to give us that respect to let us in their homes, because it's privacy. And we have to build it. The staff does a wonderful job about building relationships with these women because they've often been burned in the past. We have to build a trusting relationship with them so they know that we're going to do what we say we're going to do, and then they never want to leave us. I mean, Anne-Marie's program, when they graduate in 5 years, they're all like, we don't want to go. And I'm like, no, we're going to have another baby. No, we're doing birth spacing here, 18 months. Yeah, that meets the purpose. So with a community health worker, once they stabilize the mom, they'll step back. If there's a child involved, they will follow that family until the child's 2. So we've gotten very involved. Speaking of social determinants of health, another thing we saw spike besides smoking was homelessness. It's not our primary mission, but it has become our primary mission, one of our primary missions. We have found a lot of women. We just placed a woman who's been living in her car for a year. And this woman was working as a nurse's aide in a hospital, and she was living in her car with her child. So we've become very involved, not only through the community foundation with the LED Coalition, which we've been involved with for years, but it's safe housing for families. And I have to tell you, in my experience and talking to my housing friends, families are very discriminated against for housing, and it's great. I love the fact that they do housing for seniors and veterans, but it's very difficult for someone to want to take a mom and her kids. So whoever's out there in housing, please work on that. So we actually go in, we're helping them fill out the forms to get on Belmont. We help find apartments. I mean, you wouldn't believe, I just got a picture this week from one of my community health workers they sent me of a woman who's living in a house, and I'll tell you that the doorknob is totally broken off. So anyone who's got access, and the landlord has told her that that's her job to fix it. So this is what we deal with. We find them apartments. We have very, very generous donors that give us furniture. We end up, and we had a wonderful moving company that stepped up this year called Wayfinder Moving, and they are helping us because it used to be my staff doing this. We run a truck, we go pick up the donations, we deliver them. It's not really in our wheelhouse, but that's what we're doing. Because, you can't think about where you're going to go to school or when you're going to get a job if you don't know where you're sleeping that night with your kids. So it's been a really big effort for us to do that, but I think it's important. It's like basic life needs. We need to have a safe place for moms and kids. So that's been a big focus. And the community health ward, like Healthy Families, run support groups. So that's a little bit about them. And I think I'm gonna have Antoine now. We're gonna show the video, or you wanna have Antoine talk first?
Do you wanna?
Yeah, why don't you come up,
introduce
Antoine?
it and then we'll play the video?
Yeah. So this is the wonderkind, Antoine Johnson. Amory, do you want to say it? Antoine. Okay.
Oh, good morning, everyone.
All right, so I was very lucky to hire Antoine in 17 when we started this initiative with funding from the Oshai Foundation. And he
The Health
walked.
Foundation. Oh,
No,
yeah.
the Oshai, the Oshai,
Then
Oshai to start it, then the Health Foundation. Believe me, I fought for it. So he walked in my office and it was just like a perfect match, and we're thrilled to have him. And he wasn't even a father at the time. Now he is. So, you know, he can even speak more closely to it.
Yeah, no, this has been a great experience. Luann keeps saying that she's a lucky one, and I feel like I'm the lucky one to have come into this position and learn so much, not only about the agency, but the population that we focus on, being fathers. And like Luann mentioned earlier, I mean, they are truly an underserved population in our region, and not just in our region, across the nation, really. And that's the reason why it's more important for us to make sure that we're not only servicing the mom, the children, but that the fathers are getting the similar services and their needs met too.
Okay, so we're going to show you a video that actually, this was done in conjunction with
Say Yes.
Say Yes. So Say Yes is a big partner with ours with Fatherhood, but it'll kind of give you the history and.
I am Luann Brown, CEO of Buffalo Prenatal Perinatal Network, or an agency that works with pregnant and parenting women. And I've been CEO since January of 2015. And when I came into the agency, I felt like there was a gap in the programs that we provided. We had a Healthy Families and parenting program, we had a community health worker program that worked with women. But we didn't have anything for dads. And I felt that it was important that we were missing that piece. So I did some research in Buffalo about existing programs, and there really was not a lot. So luckily, I was able to apply to the John R. Oshai Foundation for funding, and they ended up funding us for 4 years now. And the program has really taken off, provided community need. I think that the men who are enrolled in the program feel like it's a group that they can talk with and share their experiences and also be educated at the same time. So I've been really happy with the program, and I think that it just emphasizes the importance of dads in the family structure.
Hi, I'm Whitney Mendel. I'm one of the board members here at Buffalo Prenatal Perinatal Network. I've been on the board for about 6 years, and I've served a few of those years as a program committee chair. So I've really gotten in the front row seat to watching Buffalo Prenatal evolve and to bring in the Fatherhood initiative. I have the privilege of working with Antoine and hearing all about the programs and how much they have dedicated themselves to walking along with fathers in our area and our neighborhoods, helping with things like financial literacy, connecting with their kids, navigating relationships, really just helping to build stronger, better families.
3 years ago, the Buffalo Prenatal Perinatal Network started the Buffalo Fatherhood Initiative in close partnership with Say Yes Buffalo. Being a parent isn't easy, being a father isn't easy, and there always hasn't been a lot of resources in our community for young fathers to go to. And this program was focused on 3 core tenets of it. One was the parenting initiative, second was a financial literacy component, and third, and maybe most important, was the mentoring. We've got a community of young fathers going through this for the first time together with the ability to ask each other questions, lean on each other on all the items that we talked about, whether it's financial or learning to read to your children.
Hi, my name is Rodney Tuber. I'm a father of one, Josiah, 3-year-old. And when I began the journey with this, with the Nurturing Fathers, I was seeking out how to really be a better version of myself, because I was a new dad. And growing up, I'm a Haitian American by the way. Didn't have a father. My wife passed away when I was 3. And so when I was having my son, I was concerned, and I wanted to know what it is to be a good father. So I reached out to a mentor of mine, and he introduced me to the Nurturing Fathers. Here I am today. My son's 3, and he's my heart, my everything. Throughout the Nurturing Father and the great organization it comes from, I learned some skills, and me and my son share secrets now. My communication levels are very effective with him, and I really appreciate the time and what I gained from the Nurturing Fathers program.
We exist to empower fathers and fathers who live with the resources and tools that they need to become better fathers and partners for their children and families. We rely heavily on community partners and foundations to support our program services to serve fathers and partners and Erie County.
Coming out of the pandemic, the need for engaged fathers is going to be more important than ever. Community's been in crisis in a lot of ways, both economically and socially, and having engaged parents has always proven through data to be a really effective means of raising a child. Children with engaged parents are more likely to earn A's and do well in school. They're more likely to go on and earn a certificate, 2-year degree or a 4-year degree, which means that they're going to have greater economic mobility for them and their families to take care of one another. So we're really grateful for the funders that have stepped forward to launch this initiative to date: the John R. O'Shea Foundation, Key Bank, the First Niagara Foundation, and the Mother Cabrini Foundation. And this is a call to action. We're looking for some support to continue this really critical work under the umbrella of the Buffalo Fatherhood Initiative for the years to come.
To engage with us, feel free to visit our Facebook page, Engage with Fathers, to check out more content and find out how you can support our campaign and Best Father.
Yeah, so this is our substitute for not having someone do a testimony today, but it was still good nonetheless. Rodney Juber, who you saw in there, is a great dad to his kids, and he actually joined us for a year last year through some funding that we had, and it was great in terms of having someone who went through the program, and then they were able to kind of speak to the needs of the fathers that he was serving. And so, yeah, the next thing that we have coming up as it relates to serving fathers through Buffalo Prenatal is we have our 3rd annual Buffalo Fatherhood Initiative Conference, Fatherhood Flame. And so that stands for Family, Leadership, Affirming Marriage, and Employment, which will be our focuses. And our target audience this year will be community leaders and partners. Many thanks to Nora, the Health Foundation, for all of your support over the last couple of years. But we're really looking to expand our reach in the Buffalo Niagara region and to highlight the important role of fathers and families.
And that's October
23rd, October 23rd, between 10 a.m. and 3 p.m.
Right.
Yep.
It's virtual, or you can actually go in person to, I call it the old Thruway movie theaters, but it's you guys know where I'm talking about, Thruway Mall.
Yep.
The other thing I wanted to mention when he mentioned Rodney, the other thing that came out of the program, and Antoine was like a one-man show. He's a one-man show again right now, but 2 of the dads that went through the course we ended up hiring, and they're still with us. They teach the courses, Terry Say and Mike McKnight. And that's been great because they're older dads, and I think the younger dads look at them as kind of role models. So it's been great.
They help to keep me in line too.
Yeah, they keep Antoine in line as well. They keep us all in line.
Yeah, they're great.
All right, thank you.
And just to mention, we do have materials for those who are in the building. We do have materials at the top of the table here. So when you leave, please take those. And for those on Zoom, I will email you the materials. And really, we want to educate you, but the best way for you to help us is to let your constituencies and your partners in the community know about the work that we do. The programs are only useful if people know to use them. So, we really appreciate you helping us get the word out. So I just wanted to kind of mention that and moving on.
Okay, Anne-Marie Correa, the Health Foundation Queen. Why don't you come up here, Denise?
My queen wave.
Do your queen wave. So Anne-Marie is the program manager for Healthy Families New York. She's been here a long time.
Very long.
Started,
the
yes,
best years of my life.
started as a staff person and moved up through supervisor, and now she's the program manager. So she leads our biggest program, the Healthy Families. She's got about 35 staff. So we have 53 staff at BPPN. Go ahead, Anne-Marie.
Thank you. Denise, you can go to the next slide. So what we like to say is we're not just a parenting program. And the reason we say that is because Healthy Families was designed to meet several needs of families who have high stress levels. And when I say high stress levels, there's a lot of challenges going on in their life. There's financial challenges, there might be some health challenges. Some of our families have some domestic violence or chemical addiction. There's homelessness or insecure housing because they live in very poor housing. And so what we want to do is, as Luann was talking a little bit before, if you have all these worries, it's kind of hard for you to learn. You know, it's Maslow's hierarchy of needs. You have to have your basic needs met or you really can't learn. And high stress really affects the way people parent and the successfulness of parenting. So we work very hard to eliminate barriers, to bring in a lot of different services for families, almost like a wraparound service, so that they can then attend to learning about positive parenting and being successful at it. So our target population, basically we work in 21 designated zip code areas. Basically that is east and west sides of Buffalo. We're also in Black Rock, Riverside, South Buffalo. We are in Lackawanna, stretching in a bit into Tonawanda now, and Cheektowaga. So we are really out there. We do some of North Buffalo as well, but we're not as much into North Buffalo. And the reason those zip codes were picked was because they are, there's high infant mortality in those zip codes. There's a lot of higher maternal mortality. The poverty levels are higher in those zip code areas. And so that's how, you know, we pick those areas to work in. But we're always looking to stretch out and move in more. Of course, funding is always an issue. If I receive a referral from either a community organization or a family, somebody calls me and they're not in our targeted area, it's not, oh no, I'm not, we can't. I really push to serve that family. We recently had one in Orchard Park, and the family was in need. My staff weren't thrilled to drive out to Orchard Park. I keep pushing them, I keep sending them out further, but you know, the need is there. And so it's not a definite no. So if anybody ever has somebody that they want to refer to us, but it's not quite in the target area, give me a call anyways. So I'm either going to try and work it out so that we can visit there, or I'm going to help look for a service in that area that will fit that family too, so that they're not just, you know, left high and dry because we can't find something.
Right. Anne-Marie's very good at, and the thing is, we have sister programs. There's a Healthy Families program in Niagara County. Yes. And there's also a community health worker program based out of Niagara Falls Memorial that is a community health worker. So, you know, we try to reach out. The areas that we struggle with, which I feel badly, and that's not unusual, is the rural areas.
Yes.
Because they don't have the resources.
We would love to, I mean, you know, if you, OCFS is our Office of Child and Family Services is our funders. And so when they talk about Healthy Families Buffalo, they say Erie County. But we can't cover the whole county because we just don't have the staffing for that. You know, we have to really branch out. I'm thinking if we did that, we'd probably have to have satellites, or so people are a little more closer to those areas. But we do the best we can. And we do, if somebody calls me and it's not in our area, we really try to figure out something. We do also have, there's a program in Niagara County. There's also a Healthy Families program in Cattaraugus and Allegheny County. There are about 30 some odd Healthy Families programs throughout the state, and it is recognized as one of the premier programs for the Office of Child and Family Services. So it is a pretty extensive program that's been going on for now. We are in this agency, we are in our 1995, we're in our 26th year. So old. I started
You were 10.
I was 10 when we started. And we're in our 26th year, and Healthy Families, I think, has been around for 27 years throughout the state.
Right. And we're the largest program in New York State. So we cover about 400 families.
Yeah, so we cover around 400 families.
420 actually.
420, yeah.
120. Oh, sorry, I didn't look
Woohoo!
at that.
Well, you
Yeah.
were close. That's okay. We're currently serving 378. Referral sources have really died down a bit because of COVID. We're really, trying to get back into screening more families. There's several services with our program, so it all starts at referral. When a family is referred to us, we do an assessment, and that assessment is a service in itself. So if that family is not quite eligible for our program, or if they need more than what we can give them, we are going to use that assessment to find them a program that best fits their needs. So we start that with assessment. A lot of our referral streams have dried up because of COVID and other issues with some of our clinics and birthing hospitals. So we're actually, and Luann was talking about doing that community outreach. We're actually doing that as well. We enjoyed that referral stream in the past through birthing hospitals and CBOs and clinics and pediatricians and all of that. And kind of with COVID and other things, it's just kind of, they've dried up a bit. So we're looking to reach more families. So we're out there now, we're hanging out at laundromats and at corner stores and different places in the community where we can, give out our information and talk to people. So that's something going on.
Yeah, they were very unique. I mean, Amory started this years ago. They used to sit in the prenatal clinic waiting areas, and that's where they would get a lot of their clients. And just sitting there talking to clients. When COVID hit, they obviously were restricting how many people could be in there. So we're always looking at whether it's health fairs, those are just starting up. We get a lot of referrals. I just had a call. I didn't tell you this one. I just had a call yesterday with Duval College, who has the hub with Catholic Health over in Duval, and they're very excited about partnering with Fatherhood in these programs. I told them what we did.
Yeah.
So we're always trying to find opportunities, and sometimes they pop up where you don't expect them.
Absolutely. You can go to the next slide, Denise. You can go to the next slide. I have to do all the demographics. So we are an evidence-based program. We have accreditation every 4 years, which is quite a chore. We are part of a nationwide initiative called Healthy Families America. New York State adopted Healthy Families back in 1994 or 1995. So in 1994, and they've really ran with it. We self-assess. We had participated in a random assignment study, and Buffalo was the leading site back then for the study. And the study has began 21 years ago. So it's been a long-term study. We were looking at the children now who are teenagers, and we've discovered quite a lot of information. A lot of those who have been in our program have done better in school down the road. Moms have shied away from maternal drinking, a decrease in corporal punishment, which is something that's very important for us. So we really can self-evaluate and prove that the program is beneficial and that it works. You go to the next slide. So we have 4 key goals that really are the crux of the Healthy Families program. One is to support positive parent-child interaction, bonding, and relationships. And why do we do that? We do that because the tighter the bond, the less likely there is going to be abuse and neglect in that house, and the more likely that there's going to be positive parenting. We do that through using an evidence-based curriculum that we bring out to the home. And we ask the family, it's voluntary and it's participant directed. So we want them to really navigate and tell us where they want to go with this program. What do you want to learn? But we're also teaching them how to respond appropriately to their child when there's, crying or a tantrum, or we do a lot of developmental screening, which I'll talk about. I think that's another goal. Promote optimal child and family health, development, and safety. So we do something called an ages and stages questionnaire. It's a developmental screen. We do it at different intervals throughout the child's development. We are a long-term program, so we'd like to bring in families when they are expecting, and we will work with families until the child is 5 years of age and enters into school. And during that time, at different intervals, we are doing a developmental screen to catch possible delays. If we see something, we're going to refer them to the early intervention program to make sure that's addressed. So those, we want to catch those things before they enter into school. The other thing is that we want to make sure that all family members in the household have a medical home, that mom is removing barriers to prenatal care to make sure that they are getting appropriate prenatal care, that children are getting their well child checkups on time, that they're getting their immunizations on time. These are all very important to make sure that the child is developing in the most beneficial and optimal manner. We make sure that if there's a health issue with anyone else in the home, we want to address that as well. If there's another child in the home that's in need, we might do an ages and stages questionnaire on a child that a parent is worried about, but is not the child that they enter into the program with. So we just want to make sure that everyone in the home has what they need to have to enjoy good health in life. We enhance family self-sufficiency. That meaning is we want to teach them how to, we might in the beginning, we might transport a family to clinic, to doctor appointments and things like that. When the family graduates from the program, we want to make sure that they know how to get to the doctor on their own. How do you access a Medicaid cab? What are the bus routes to get to the doctors? We want to help them find employment. That's a real big issue. And we work very hard on that, helping them build a resume. How do I interview? Maybe even helping them search for jobs, look in employment lists, get online for that, or looking in the newspaper. So we do a lot of that because one of our goals is that they are self-sufficient, that they are working. We try to get them off of public assistance if possible, or at least not have to rely solely on that. The next one is to prevent child abuse and neglect, which is the real crux of the program. Is the more, as I said, the more highly stressed a family is, the more likely they are to not be successful as parents. Nobody starts out when they're expecting a child thinking, I'm not going to be a good parent, or I don't want to be a good parent, or I'm going to abuse my child, or I'm going to neglect my child. A lot of stressors come in the way and interfere a lot with parenting, especially with families that are living in these zip coded areas. And so we want to work really hard to remove those barriers. We do a lot about how detrimental corporal punishment is. We look to build on strengths. Some families have a lot going on, and maybe the only strength is that they really want to have this child. And so we build on that. We talk about protective factors. Protective factors are those little positives in their lives, and we want to build on those protective factors. So we're looking to, again, address ACEs in that roundabout way. So we have 21 family support specialists. They're the ones that actually visit the families in the home. They're broken up by 4 teams with a supervisor on each team. We do a lot of nurturing our staff. We do that because we believe in the parallel process. You nurture the staff so they can nurture the families, and the families can nurture the children. So we want to eliminate burnout and stress. It's a very stressful job. So we do a lot of supervision. They get protected time every week to just kind of unload. We also have a team of assessment workers. So we have 2, we call them family resource specialists, and they have a supervisor as well. And they're the ones that go out when they get the referral. They go out, they do an assessment. It's like a snapshot of what's going on in the family at the time to kind of really understand what their childhood experiences were and what is going on with them at that moment in time when we're speaking with them. We receive referrals from the different, like, as I said before, prenatal clinics, birthing hospitals, different organizations in the community. Referrals have slowed down quite a bit, which is a bit concerning for us. So we are hoping to kind of get back into that. We did a lot of hanging out at clinics, hanging out downtown at the Raffle building. They were gracious to give us a table out there, hanging out around WIC and other places. But with COVID, it's hard to get into those places now. So we're just trying to rethink everything. These are our community partnerships. go on to the next. And then just, we like to have fun. So we're always doing fun stuff. I mean, it's, you know, it's, we want to, we do things together as a team. This is actually just about the whole agency. I think we do a retreat every year that Luann is gracious enough to lead. And so we take everyone to Beaver Hollow, and we do a lot of different team building activities. So that's a picture of that. We do a lot of picnics. We want to do a lot of outside activities. For one thing, we want to show families that there's a lot of things you can do in the Buffalo area that you don't have to spend a lot of money on. I have a staff person once, I was observing her in a home visit, and she said to the mom, we look at observing interaction between parent and child. And so it just was a really perfect moment where mom was talking to the baby's cooing, and we call it the dance. You know, there's a response, the baby's moving, cooing, all of this. And the family support specialist said, see, you are your child's favorite toy. And that really says a lot. That means, you know, you don't need the most expensive toy. You don't have to have a lot of money. You don't have to have the best home. You don't have to have, you just have to be you. You're the most important person in your child's life. And your child only needs you. We do scrapbooking. Scrapbooking is a way for families to bond, not only to bond with their child, because you're proud, you're bringing in your pictures with the baby, and so it's forming some bonding there, but also bonding with other parents. So they get together. There's a lot of friendships that have been formed through our scrapbooking sessions. They're very popular, and I have a very talented admin assistant
Who can never retire.
No, she can't go until I go, because I'm an idea man. She's the one that's creator. I come up with an idea and she just doesn't. Go to the next one. So we do a lot of support groups there. We meet monthly with support groups. So we do support groups on various topics on parenting, and some of these are well, we did a Dr. Seuss read, and this is a mom actually who wanted to be the Cat in the Hat, or else I would, because I like to dress in costume. So so she really enjoyed that. We do Black History Month. The support groups are very important, again, because parents can build relationships. They learn that they're not the only ones that are going through some of these situations. They bond and they become support systems for each other, which is something that we want.
Speaking of dressing up.
Oh yeah, speaking of dressing up, there I am. There's my costume. Oh, I was a Princess Leia one year. There I was, Abby Cadabby. I like costumes. It's fun. I don't know. If I can dress in a costume, I'm there. I also like a good party. Fall feast. We do Thanksgiving every year. We call it a fall feast because not everybody celebrates Thanksgiving, but we do want to, again, thank our parents for participating. It's not easy letting someone in your home. It really isn't. And the fact that they do that on a regular basis is just astounding. I don't know if I'd want someone in my home all the time. And we're intensive. I mean, in the beginning, we're in their home every week for at least 6 months. So that's when the baby is first born. And prenatally, in the beginning, it's twice a week, twice a month. But then it becomes every week as they're getting close to birth. And then we're there all this time. And then we kind of gradually, back off. But it's a lot to let someone in your home. So these are ways to thank them.
And the staff does all the cooking for the fall feast. They're all wonderful cooks. So
we're all cooks. Christmas, we wanted to make sure that, it's tough to get to that, to get to the mall sometimes, and it's expensive to have a picture taken with your child. So we do that free of charge. Easter, this was actually a COVID Easter. So we couldn't really do our groups. So we did our groups virtually. My admin assistant, she stuffed about 1,500 to 2,000 eggs, and we made Easter baskets and delivered them to the children. Usually we have them in and we do an Easter egg hunt and all of that stuff. So, and then Black History Month, something else that we do every year. It's really important for us. We want to celebrate the different cultures that that families are identified with. And so Black History Month is Hispanic Heritage Month. Sometimes we do a taste of home visiting. We haven't done that one in a while. And that's really, we look at the different backgrounds, ethnic backgrounds that our participants have. And we set up booths and we do, all this information on them and samples of their food. Sometimes the participants, they want to they want to bring in a sample of their food. So we do a lot of that as well. We do graduation. So after 5 years, we do it. As Luann said, sometimes they're like, can we stay? No. What if I have another one? No. So the idea is that we've given you everything you need so that when you have other children, for one thing, birth spacing, but then when you have other children, you don't need us because you know how to do all of this. Thank you very much for the time.
I want to mention, just because I love this story, and it's always about outcomes, and you just never know when you walk in. So I told Amory a couple months ago, I'm in for my doctor's appointment.
Oh yeah.
And the nurse that's taking my history, a new EMR, and she was trying to, enter all my information. And she says to me, where do you work? And I said, Buffalo Prenatal. And she looked at me, and I looked at her. I said, were you a client? So this woman, she got pregnant when she was 13. And she said, my mother wasn't playing. She said, if you think I'm going to raise this baby, you're wrong. So she said, I got in your program. And she said, there's no way I would have been able to do what I did without the program. And her worker is still here today. She remembered her worker. She said, you guys gave me the confidence. So now that baby is now a senior at Elford. She has another child. She went to nursing school. So those are the stories we love to hear about. And that shows you the outcomes that the staff, you don't realize sometimes the impact you have on people. And it was just a wonderful, we're going to be interviewing her for a testimonial because it was a great story. And she was so appreciative. 13 years old, and that's where she is now. So
we do hire our participants.
We do. 17% of our staff are former program participants. So, which is a great message because they've walked that walk and they can really speak to the clients about it. So those are like my best employees, I think.
Absolutely.
Anybody have any questions on Zoom or on in the room? Totally overwhelmed you.
I know, I went on and on, sorry. Once I get going.
Can I just add a little something?
Yes. Yes.
Hi, this is Whitney again. I'm one of the board members.
Oh, hi, Whitney.
Hi, been on for, I don't know, a long time, 6 years or thereabouts. And it never gets old to hear and to see, and this like beautiful little form of all that they do. And I don't think that this presentation, although beautiful, captures the dedication that all of the staff have. They're tireless, and I hope that comes across in how they managed COVID and pivoting to continually meet the needs of individuals, and how much they're dedicated to empowering individuals. They're not trying to maintain power over something or keep the resources. They're trying to help people get what they need to go where they want to go, wherever that might be. And I think that's pretty unique among a lot of organizations. And it's something that I've been really proud to be a part of and play any role in participating in. But the dedication is incredibly impressive, and they do all they can to be, because I think it was, I don't know, Anne-Marie, if it was you or somebody else that said, oftentimes the workers are the support person for the individual or for the family.
Yeah, that's correct.
Right. And we know about resilience, it takes just one person, and oftentimes BPPN and their staff are that one person for an extended period of time. And then they have these groups that help people find each other to do this work with as they grow. So I just wanted to thank everybody for the work they're doing. Again, I'm so proud to be part of this organization in any capacity, and to know that you're moving from a place of compassion and empowerment is something that I think is really beautiful.
That was Whitney Mendel, who's one of our board members who chairs our program committee. She also, this year we took on, like many other organizations, in light of all the racial issues that were going on, we have a cultural awareness initiative right now. And Whitney actually co-leads that with Sherelle McLean, who's our LNSW, where we actually have meetings every month with the staff. Some are mandatory, some are optional, but it's a safe space for the staff to talk about things that impact them. So we appreciate you, Whitney, too. Did you have a question?
Jess? I have a question. I've been aware of the organization for a number of years now, having working with the senator, but you all are doing a phenomenal job. It's really a pleasure and an honor to have an organization like this in the area and to focus on the populations that truly need the support here.
Right.
you know, you always have a friend in our office.
That's right.
Oh,
That's
he's
right.
been a great, he's been a great
Yeah,
friend.
this is Jessica LaFalls
Yeah.
from Senator Tim Kennedy's office, who has been a huge supporter. I mean, he's been here, he's come to these sessions. He's been a huge supporter of ours. So, and actually was one of our winners a couple years ago at our Great Baby Beginnings. So
He's been to our Healthy Families activities.
Yeah.
He's
Solid. Anyone else have any questions or comments?
There's a question on Zoom on the chat about number of clients that are served per year.
We usually say about 1,000 because between the, whatever it is, 420, 385 for you, the community health worker, you know, both the programs are structured. I mean, like most programs by caseload. So they usually carry 20 to 25 clients. So the community health worker, they turn their clients over a little faster than Healthy Families because of the length of the program. So they carry 200 women at a time. So between the moms, the kids, the dads, which usually about 1,000 people a year.
And if you're, you know, talking about Healthy Families as well, it's not just those that are currently served, but our data count also counts people who refer to us and receive some type of assessment or some type of referral. So if you're ever interested, I can pull that report out. I got that in data. So yeah, it's amazing though, the breakdown. You know, when you think about it, like the thousands of home visits that we do in a year, based on the families, it's quite lengthy. But if anybody's ever interested in any data, let me know, because we got some of that.
The only other thing I wanted to mention too, that I don't think that you all highlighted enough, was the systems level change you're working on. So we're trying to help people build resilience and have the skills that they need, but you're also trying to change the environment so they don't have to be as resilient around housing and lead and different initiatives where you partner to really make concrete structural change in these social determinants.
Right. Yeah. You know, it always comes down, and they deserve all the credit, the staff, because they do the hard work. And we mentioned the retreat. We actually have our retreat next week. And our topic is actually going to be employee mental health, because we've seen it firsthand with our own staff. But I think it's a really important topic. I mean, you can read any article about COVID and the impact COVID has had. As I mentioned, most of my staff are single moms. They've got their kids in the Buffalo Public Schools. They're struggling with that virtual, so we felt like it was a really important topic to tackle.
Well, speaking of people who sing a lot of praises, we should sing Luann's praises because she's been a phenomenal leader these last 5 years. I think this agency has grown exponentially since she started, and she's always supportive of this. I mean, always supportive of the staff, and just always looking for ways to, to relieve their stress, to do things to show our appreciation for them. She listened. She's got an open door policy. I don't know. I can't say enough about her.
Is your evaluation next week?
Yeah. Can I have a raise?
Yeah, you're sucking up to me.
No, but we got to get that out there. I mean, you're really good at praising everybody else, but somebody's got to praise you.
Thank you.
Marie, that was very well said.
Thank you. Thank you. Any other questions or comments? All right. Well, I want to thank all of you on Zoom and here. Please, you guys don't have donuts where you are, but we have donuts here. Please help yourself. If you have any questions, please call me.
Or the website.
The website, www.bppn.org. You can actually, we tell all our referring, you can actually do a referral online now. So it's made things very easy.
Please grab materials. We have our annual report here, information about all our programs, fatherhood programs, and something else that is new this year. We have a bequest society in honor of Dr. Laley, who passed away last year. So we're asking people to think about us for the will to give in the future. So there's information about all that here. And again, I will email all the information to everyone, even if you're here, about upcoming programs. And so thank you very much for your time and attention today, both in person and on Zoom.
Thank you.
Thank you.
Thanks, Anne Marie. No, I just had to get mine out.
I'm sitting there like, you know, I've got 11